The Zewert Office in Las Ventanas Surgery Center is surrounded by live oak. There's very little traffic here. It's very private and it's a calm location. Just an amazing environment in the hills outside of Monterey. Our new combined office and surgery center is AAA HC certified, really at the highest standards for outpatient surgery. The highest level of technology, ventilation systems, surgical lighting. We designed the facility with patient comfort in mind. There's a unity of theme, which is calm, clean, and professional.
What I really liked is I felt that the atmosphere was professional, it was relaxed, it was realistic. That's what I wanted. Not a lot of glam, not something that wasn't achievable to be done to me. And so when I went for the consultation, started talking to Dr. Z and explaining the areas that I had concern, because I wasn't really sure what could be done. There was never any pressure by the doctor, none whatsoever, about when do you want to do this. There was no hard sale. It was more informative. It was enlightening, and all of my concerns were addressed. I felt really comfortable internally at that time.
I think there's also a comfort level having the surgery center right next to the office so that the patients are familiar with the environment.
They don't have to park at a huge hospital that has multiple entrances to the parking lot and figure out where they need to go and get lost. To be able to just come right up to the surgery center and park, I feel like it's really great for the patients.
The nursing staff went ahead and contacted me regarding the pre-op procedure and had identified where I would go, and I was surprised that the surgery center was at the same location as where Dr. Z's office is as well, recognizing that it's a surgery center as well as he has his private practice. I really like that idea. That was convenient. And so it naturally brings a sense of ease. You're already familiar with the environment, you're familiar with the staff, and so it was a comfortable segue to the surgery.
Excited?
I'm excited.
Wow, fantastic. There are parts of your face that are really amazingly youthful, like your mid-face, and the overall contour, what we call the cervical mental angle, which is where your face meets your neck, is the overall contour is really, really nice. You just have a little bit of loose skin and we can see your muscle there, your platysma muscle. So those are things that really have aged really well. Your lower eyelids are in really good shape, but then you have just this heavy jowl, and that's primarily from this. There's a ligament, there are two ligaments here. I want to tailor my procedure for what is, what the patient needs and not do more than is necessary.
Okay.
But in your case, we really need to release those ligaments. Otherwise, they'll tether this and it won't allow us to really get a good repositioning, a more youthful repositioning of your lower face in that area. Your case is a really fun one for me as plastic surgeon, because I think there's so many wonderful attributes of your face, and we just have this one area that's aging a little aggressively, and the neat part is that we have the tools to really do a great job and restore balance and really have a fantastic result. For the appropriate procedures, outpatient facilities like the one we have is actually safer for patients. Having a operating room and recovery area that's specifically designed for cosmetic surgery is a huge plus. The procedures are performed more efficiently. It's a calmer, less threatening environment to the patients.
The flow of the surgery center, so that we can get ready for the case of the day, it's just so much easier when you have a nice setup. It makes it easier on the whole team. I've been working with Dr. Zewert for about 2 years. He's just a great surgeon to work for. You know, he makes everybody really comfortable in the OR, and he's so good with the patients.
Knows what he wants in terms of his equipment, knows how to prepare his team. Our anesthesiologist, Dr. Ropes, does an amazing job.
Just as it's important to specialize in a certain form of surgery, it's important to specialize in a certain type of anesthesia. And being dedicated to this center, you know exactly who's coming to give anesthesia, and it's not like in other cases where schedules might change at the last minute and there might be someone completely different than who you expect show up that day.
Most of our nurses here are cross-trained for pre-op, post-op, and intra-op. That's really good for our team. They're able to help the patient in all areas of care. They go home after discharge knowing that there's somebody there to help them with any questions or any concerns they may have, because there is an answering service where they can talk to the surgeon immediately if there's any concern that arises. So we talk about preparation, you know, having all their post-op medications ready, having food that's appropriate for the procedure. She is aware that this is a long operation, so I told her, you know, make arrangements for your family to either, you know, have other plans in the area, or they're welcome to stay in our lobby. We'll call them once we're about halfway, and then we'll call them right before we come out of the OR to keep the family involved and aware of any changes or time estimates. So that's a big one, because family gets concerned about
if we go a little longer. Yeah.
So we like to keep them abreast of any changes.
We're always reminding the patient of there's so many things to remember. And so to have everyone coordinated, have the whole team, it really makes the experience safer with a higher chance of greater success. And it's one thing being good, but you know, to get to that next level of excellence where you're minimizing trauma to the patient and you're minimizing time on the operative table and all these things that help the final result.
After having the surgery, the type of follow-up treatment was just phenomenal. And then the doctor was very in tune to what was taking place in the healing process. I felt just so secure in what had taken place as far as a surgery goes. And the results and the healing came together just perfectly.